Welcome, everyone, to today's From the Frontlines, Life Science Care's new, I hear my own echo. Hold on one second. Life Science Care's new webinar series where we have conversations with our nonprofit partners who are literally working every day on the front lines during this COVID-19 crisis to feed, shelter, take care of our neighbors in need. We have some great special guests today, so I'm really excited to introduce you to them. Just a couple of housekeeping items. If you have questions for our panelists, use the Q&A box. Christine Castellini from Life Science Cares is going to moderate those questions at the end, and we'll ask our panelists questions that come through from the audience. So feel free to put your question in Q&A. And this is a series that was born out of Life Science Care's COVID-19 fund. And I want to thank everyone who has participated in contributing to that fund. To date, we have raised $1.75 million. We have made over $900,000 in grants to nonprofits in the last 6 weeks, and are committed to continuing to support the real-time needs of organizations as they really mount incredible responses to the changing needs in the community right now. So thank you to everybody who's participated, and we're excited for you to hear about some of the work that's happening today. First, it is my pleasure to introduce Mark Mallon, the CEO of Ironwood. And I have to say that pretty much 2 months ago, as we launched this fund, Mark and the Ironwood team were the first to step up and make a significant contribution to these efforts, really helping Life Science Cares set a tone for companies and individuals to say, get behind us, we're going to do something pretty special. So I will turn it over to Mark with our sincere appreciation for everything he and the Ironwood team have done to make us so successful.
Your instructions too well, Sarah. I was still muted. So thank you, Sarah, for inviting me to participate today, and thanks for allowing us to be part of what you're doing with this fund. We were really happy to be able to be one of the first backers. What I'd like to do is just take a moment to give you a bit of background about our company, Ironwood Pharmaceuticals. I feel it's a very special place, and I just wanted to say a few words. You know, we're a leading GI gastroenterology healthcare company, headquarters in Boston. Although, of course, right now, actually, our employees are spread all over the the region, actually working from home. But dedicated to advancing the treatment of GI diseases and seeking to redefine the standard of care for millions of GI patients. There are approximately 70 million Americans that's suffering from GI diseases today. That's 1 in every 5, and that means our work has the potential to improve millions of people's lives. And we all want to our work to be meaningful. I think that's true for everyone. And given statistics like this, it's clear that our focus to help improve GI patients' lives truly gives meaning to our work. And this helping people, I think, that really need it is a shared focus with LSC on improving lives that kind of make our partnership special for us. And with them it's really, this partnership is very near and dear to our company's heart. Ironwood has had the privilege of working with Life Science Cares team for a number of years, and we applaud your tireless commitment to eliminating the impact of poverty in the greater Boston area. Your rapid response to the pandemic through the COVID-19 Response Fund was a much needed initiative to help meet the emerging needs of some of the hardest hit populations in the Boston community. Hats off to you and your team for working so quickly, day in and day out, to provide support and resources to many people that really need it. When I arrived at the Ironwood as CEO in early 2019, I was in awe of how our organization faced many challenges while experiencing tremendous growth. But the environment we are now in is beyond any of our candidly wildest imaginations. It's really been challenging. However, if there's one thing I've learned over the last year and a half, is that our colleagues are talented, dedicated people who pull together to turn challenges into achievements. As the pandemic has taken hold of all of our daily lives, we've come together to continue our work in creating medicines that make a difference for millions of patients living with GI diseases, and to keep our employees, the beating heart of Ironwood, safe, strong, and in tune with community needs. I always say that thoughtful partnership and collaboration is central to our mission at Ironwood, that how we do things is as important as what we do. So community outreach efforts like those initiated by Life Science Cares are part of our DNA, and being part of those types of outreach efforts is something we really want to continue to do. Witnessing, participating in these efforts has been a silver lining against the COVID-19 cloud that hangs over all of us. And while the pandemic has been taxing for countless members of our community, it has reminded us of one of our company's most important values, and that is the value of really humanity, and doing what we can in an effort to preserve our humanity, even in the most difficult times, is essential. I'm proud of the early support we've been able to provide for the COVID-19 relief efforts to date, including our donation to the COVID-19 Response Fund. We're grateful to have this opportunity to lend a much needed hand to our friends and neighbors during this ongoing health crisis, and we look forward to continuing these supportive efforts. Interestingly, this crisis has provided us with an opportunity to refresh the reputation of the pharmaceutical and biotech industry and show the world that we are, as an industry and as Ironwood, are stepping up quickly to respond to the ongoing and emerging threats of the pandemic. Every week, I have a pleasure of speaking with other life science industry leaders to share best practices and updates on what we've been doing and learning to help patients. I'm confident that over the coming months, the life science industry will continue to help us navigate through these most trying of times. Proud of our industry, and I'm grateful to Life Science Cares for their ongoing commitment to helping our most vulnerable populations. And with this, it's a great pleasure for me to turn it over and to welcome Josh O'Brien, the director of the Men's Inn at Pine Street Inn. And when you think of an organization, actually, I think of it as an institution in Boston in helping people for, I think, over 50 years now, and the most people in need of help. It's truly an incredible organization and incredible caring of people for many, many years. So Josh, over to you.
Thank you so much, Mark. Great to be with everybody. It's really an honor to be with you. We just, first of all, so much appreciate the partnership, both during this pandemic, where you've stepped up, unlike many others, and also prior to COVID. And we know we partnered. We saw many of you at breakfast lines, through our welcome home baskets. This year, my office is based out of the Men's Inn here in the South End, and we're privileged to see your decorations up this holiday season, and have that partnership working, seeing you in the Men's Inn this year. So we appreciate all you've done pre-COVID and in this kind of new world we're in. Many of you are very familiar with Pine Street, but I just want to step back COVID minus day one and just kind of give a sense of where we're at pre-COVID. As Mark, as you said, for 50 years, Pine Street's been serving individuals experiencing homelessness in New England. And we know homelessness is complex, involves a lot of trauma, mental health concerns, substance abuse concerns, physical ailments, economic difficulties, and usually all wrapped into one. So we've been privileged to serve the community for 50 years, one of the largest providers in North America and the largest in New England. We have 4 different emergency shelters. We have 2 in the South End, 1 in Dorchester, and 1 in Jamaica Plain on the campus of the State Department of Public Health Hospital, the Lemuel Shattuck Hospital. We serve about 700 guests per night pre-COVID. And just to give some sense of scale, last night at our Men's Inn, which is last winter at the Men's Inn, which is our largest shelter, we served over 526 guests just in one night alone. So if you can think of pre-COVID, very, very full, very crowded, lots of need, and doing the best we can in that previous environment. In addition to the shelter beds and the shelter services, we offer 24/7 outreach in the city of Boston, working in partnership with the city. So every day of the year, rain, sleet, snow, you'll see our vans or our walking teams out in all across the city, all the neighborhoods of the city, helping folks that for whatever reason aren't coming into shelter. We're really pleased to also have a training program. And if you've been on the breakfast line, you may have seen some of our trainees as well, serving 160 trainees a year in a housekeeping training program and also in a food service training program. And amazing results from providing that opportunity for guests to be able to learn skills and great placements with many of our partners like the 99 restaurants and others to achieve permanent work after their placement. One of the cool things about being in the shelter and working with our trainees is not just the trainees themselves, but the hope it gives our other guests prior to even thinking about going into the training program, when an outside job or experience seems way too far off for them. Being able to do something inside the shelter has been great. And they're still working with us and serving with us to this very day, even through COVID. We also have about 850 housing units across the city that we own, manage, or support over 35 different locations. Pine Street has a staff of about 500 full and part-time staff, and about 200 of those are serving right now on the front lines during COVID. So a lot of our staff are, as many of us are, working from home or remote, or finding alternate ways to get their jobs done. And the average age of our individuals that we're serving is about 55 years old. In terms of COVID, day one before COVID, we're still operating. It's still busy. There's lines. The dorms are full. And you can imagine an environment where everybody's suddenly from one night to the next being told to social distance, stay 6 feet apart, stay home. Our guests were scared and not knowing, I'd walk past a group of 40, 50 guests and watching the news at night. And there's just laughter when somebody comes on and says, okay, make sure you're staying home and staying 6 feet apart, when it just in those early days was not possible for our group of guests. So we immediately jumped in and tried to do the best we could to provide some distancing right away, even before we were able to decongregate the shelters a little bit like we are today. One of the first things we did, I don't know if you're, I'm telling my age here, but I used to watch a show called MacGyver, where MacGyver would take some twigs and something else and come up with this amazing invention. So we took fishing wire and shower curtains and tried to put dividers in between the beds. Just any day we could make some improvements. We installed the plexiglass at all of our front desks and areas where we had a lot of guest contact, where guests would come up and talk with us at a desk area. So really important to do whatever we could. We then moved on to expanding our meal service. So if you were with us for breakfast, breakfast service was about an hour, and we extended breakfast service to 2 to 3 hours. Same with dinner as well, so that we could spread guests out, make sure that the guests had an opportunity to have space at their table, not have anybody sitting next to them or across from them. We expanded our lobby to include the cafeteria when we weren't having meals, so the guests could spread out even further. We opened our dorms 3 hours earlier than usual to try and give the guests a chance to go upstairs. And then, of course, including our internal team, but also some vendors to come in and do 24-hour cleaning and disinfection of all of our facilities. And if you've been to the campus here in the South End, it's an old turn of the century headquarters for the Boston Fire Department in the early 1900s. It's a huge building, lots of railings and doorknobs and doors and places to touch, benches and tables. So there's just so much work, and we're so proud of the trainees and staff that do that really important work with us. We also had to limit our volunteers and other folks visiting the campus. And we really, the lifeblood of Pine Street is volunteer work. So that was a real challenge to make up for that. One, we missed the spirit of our volunteers, but also just not having that support on site has been a challenge, but of course, the right thing to do to keep our volunteers safe, as well as the staff and our guests. And then we initiated, in partnership with Healthcare for the Homeless, so I know you had a similar Zoom call with very recently. So Dr. Dave was talking a little bit about how you separate out 450 guests at a place like Pine Street. And he's absolutely right. We had lots of challenges with that. One way to make sure all of our guests who are staying with us are as safe as possible was to work with the city and Healthcare for the Homeless and the Public Health Commission to do widespread testing. So in early April, late March, early April, we did some widespread testing here, starting with the men's inn and moving to our other shelters. And the initial results, as you may have seen on the news or in the newspaper, was about 36% of our guests were testing positive, which if you think of the hundreds and hundreds and hundreds of guests we're serving every day, it's a lot of guests that are testing positive. And those couple of weeks when we were doing the testing, getting those results, it would take a couple of days. There was a lot of fear amongst the guests, frankly, fear amongst the staff, what those results would be. And as one of the individuals privileged enough to be here at that time, I can just share the stories that each guest would share, their fears, having to inform one of our guests, and many times over that they unfortunately did test positive, asking them to come outside the building with their belongings, and having that discussion with them was something I've never had to experience before. Really touching to see that guests would open up and talk about what they're afraid of. Some guests wouldn't open up, but really be afraid. And if you think of sometimes it can take years for our outreach team to convince someone even to come inside. So now finally we have a trusting relationship with someone who's inside the building finally, but still not necessarily trusting generally. And now we're saying, well, come outside with me, and you tested positive, even though in many cases you're feeling fine. But we're going to send you in a vehicle you've never been in before, with a driver you don't know, to a location you've never heard of, to a tent in a place with people dressed like you've seen on TV and movies, who you also don't know. And I don't know how long you're going to be there, but trust me, it's for the best. And going through those conversations over and over and over again, it was just amazing, the humanity of the responses, and a reminder of the hopefulness and the trust that that has been built up over the years. So I really think for a place like Pine Street, in that moment, it wasn't the conversation in the moment, it was the relationship that's been built up in some cases over many years that allowed that transition to happen. So thankfully, almost all of the guests that tested positive accepted that transportation to either one of the city or healthcare for the homeless isolation or quarantine centers. And then we're able to be healthy again and thankfully come back at the end of that time. We also offered triage to all those guests that said, I don't want to be here anymore. I don't want to be, obviously that no one wants to be in the shelter anyway, but especially now. So our triage team works 7 days a week, did then, still today, to try and provide alternatives, not shelter alternatives, but housing, friends, family, any alternative we can other than shelter. And so they're working hard to try and support our guests in person and on the phone at all of our campuses to try and make sure that there are some alternatives to shelter for those that want it. I'm grateful to say we did some new testing over the last 2 or 3 days, and our result was down under 10%, where it was 36%, just a few weeks ago. So I think the measures that have taken place, we've limited new entries to try and make sure that those in the building feel safe. And as we continue to test, want to make sure that that we're doing monitoring testing at this point. And I think all the cleaning and the support we've had from the community has really paid off to limit the exposure and risk for those in the building. And one of the things for the staff here over those 3 weeks and coming into today, pretty intense time. I know for me personally, I didn't go home for almost 4 weeks. And that sense of adrenaline from that moment, I kind of remember the first moment of, oh my God, this is going to be something, to about 4 weeks later. And I almost remember that moment when we kind of got into a bit of a new normal, and that adrenaline started to drop and you just crash. And I think for our team, that's replicated dozens and dozens of times. A lot of our team were here, they do double shifts, go out to their car, get some rest, come back for another shift, because they want to support our guests, but they also wanted to be here for each other. We had a couple of staff members, one that allowed me to share his brief story. We had some staff members test positive as well. And this other staff member tested positive, did get sick, not hospital sick, but managed his symptoms at home. Fought really, really hard to get through and come back. Unfortunately, while he was out, his brother contracted COVID and did pass away from COVID-19. And in talking with this staff member who's right on our front lines, he's one of our guest service specialists, offering time off, support, whatever we could do to support him personally in his COVID experience, but also with his brother's passing. And before his brother passed, he wanted to get back, and he said, I can't bear not helping my teammates and not being there for the guests. It's what I want to do. I want to get back. I want to help. And after his brother passed, we had the same conversation, expecting he would take some time off. And again, he said, I can't honor my brother right now. I can't do anything. We can't have services, but what I can do is honor him by coming back and helping my teammates and helping our guests. So I think that's a extreme example, but one that just indicates the passion that the team members here feel to support each other. And I think we talk a lot at our change of shift meetings about, if not this group, then who? And so everybody feels really passionate about, even though there's risk in being here, I think everybody accepts that risk. We've had incredible support from you and other partners and the agency itself to keep us safe. We have face shields, masks. You can see the picture of Emilio Baez, our housekeeping manager, getting some masks ready for our guests. We have face shields and masks for all of our staff, a lot of precautions in place, staff testing. Boston University opened a dorm to us so that our staff who don't feel safe going home for whatever reason can stay in the dormitories for free and be safe there and not be worried about going home. The change of shift group, I asked if there was anything they wanted me to share, and one of our assistant supervisors stood up and said, just let them know it's what we do. So they just wanted to communicate that they feel honored to be able to serve in this way and to give back, and feel like they wouldn't, even though there's risk to it and they accept that risk, they wouldn't be any other place. So I'm really thrilled to be here. We're hoping moving forward that there is a new normal. We really want to take precautions where guests that stay with us can feel safe and protected. And I think Barbara's going to talk a little bit about some of the resources and what it takes to make that happen. But it's a pleasure to talk with you a little bit, and I'm happy to answer any specific questions. We're really honored to be here, and thank you for your support.
Can people hear me, if not see me?
Yes, we can.
Okay, terrific. If you can't see me, that's fine. But I thank you, Josh. And, Josh and his team have clearly been the frontline people out there doing this work every day. Some of us, I call us the sidelines, the people that are more in the administrative functions. We've been working off-site like many others, and really just hearing and seeing what's going on. It's pretty amazing. So one thing that we're thinking, when this all sort of started to happen, Pine Street was coming out of our winter time mode where, Josh says the shelters are super busy and crowded, and, we were sort of at the tail end of that. And also to say, we're in the crisis business, so we deal with crisis on a daily basis, but obviously this was a whole other level. We were probably better prepared than a number of different organizations and businesses, but certainly no one saw this coming in this way. So, we quickly, as Josh said, we had to quickly kind of gather ourselves and really sort of, kind of look at what we needed to do. And, one big thing that's come out of this is we've said we can't go back to where we were before. We can't go back to crowded shelters. We've gotten about 240 people, most of them older and more frail, into these Suffolk dorms now, and they're doing really well there. And, our plan is not to bring them back to the, sort of regular shelter population, but now the quest is to find an appropriate setting for them, at least midterm, and really, permanent housing, which has been our focus for a long time, now is really the imperative. What we find, I'll just throw out a few statistics about our housing program. There is a cost savings of about $11,000 per person per year in mostly healthcare savings, emergency rooms, inpatient stays for people who are in housing. So that's pretty significant in and of itself. In addition to that, it's really successful. We have a close to 96% retention rate in our housing. And, some of these folks have been homeless on the streets, some of them for as much as 10 to 20 years. But when they have the stability and they have the services that wrap around, they can do really remarkably well. The other thing in Boston, which is a real plus, is that we all work on one plan. The mayor of Boston and the city are very much behind these efforts and have really worked closely with us on housing and during this whole pandemic. So in Boston, we have an under 3% street homeless rate. That means fewer than 3% of the people in Boston who are homeless stay on the streets. Now, just to give you some context, in some West Coast cities, which I won't name, but there's some of the major West Coast cities, we're not trying to put them down, but there's more than 50% of people who are homeless who stay on the streets. And if you've gone to some of the major cities on the West Coast, I haven't been there recently, but people say there are just encampments everywhere. So that's a good thing, but we're still not where we want to be. So now our focus is even that much more towards housing. One of the things is obviously, we have to look at budgets and the costs of these things. And just to give you a sense, I was startled by the statistic. It's costing over $250,000 per week during this pandemic. That's for, staffing, extra staffing, sort of hero pay for the staff, frontline staff. It's for all the new protocols we've had to put in place. It's for a whole variety of things. And, I've asked Lindy O'Downey, who's our president and executive director, do you see this, do you see this cost going down anytime soon? And she really doesn't. I mean, this is just a whole new frontier for how we have to look at these things. So, clearly costs are always an issue, our concern. And luckily, through groups, like Life Science Cares and a number of other organizations and groups, people have really stepped up and supported us in a big way. And it's just been an amazing outpouring of support. One of our fears, we get private support, individual, corporate, foundation, as well as city, state, and federal support. And our concern is really around, given all the issues now with cities and towns and revenues in the state, that we are really concerned about facing some major state budget cuts as the year goes on. So, that's always, so, the organizations like yours who step up and help us out financially, as well as through the volunteer work you've done, it really means so much to us. And just again, I mean, that's pretty much, kind of the overview of where we are now. As I said, we are really planning ahead. We have the Suffolk dorm through August 1st. We don't know whether their students will be back on campus yet. But we are really feverishly trying to find alternatives for our guests so that, again, we're not going back to the, more crowded conditions in the shelter. So again, I just want to thank you so much for your ongoing support. And yeah, people have questions. I know we're happy to answer.
Thank you so much, Barbara. I know we're close to our time here. I do want to just give a shout out to our good friends, Sam Truex at Quench Bio, and the group she has through the CEO Forum, currently operating a drive for activities for many of your shelter guests now that they are isolating or stuck inside by themselves. And so there was a picture of Sam dropping off some stuff. That effort is still going on through the long weekend. And so if folks are interested in that, feel free to visit the Life Science Cares website, which I'm going to just move forward a little bit. For folks who haven't been on one of these conversations before, we always wrap with this picture. Right on our website, we've created a COVID-19 response directory, which includes information about how to make a contribution financially, but also, as this evolves, how folks can get involved in virtual volunteering, buying items or donating items off of various wish lists for our partners, including Pine Street Inn. So take a look there. We are updating it very regularly, and actually in the next week we'll be updating with information on our summer of service. Our very popular summer of service volunteer campaign will look a bit different this year, but it's going to happen. And so we encourage people to continue going to the Life Science Cares website to get information on those efforts. I want to thank Josh and Barbara and Mark for joining us today, and everyone who's watching. We really appreciate everything that you have done to give back in a time when there is really, really significant need. We will be in touch with details on our next program, and we wish you all a very relaxing and safe long weekend. Thanks, everybody.